surroundings. Oh no, my computer closed. Just kidding. Oh, and here's where my computer is. Okay. Okay. I'm first going to do a brain dump. Okay, good. I didn't turn the pillow orange. Hi, my name is Danielle. I'm going to be your student nurse today, performing hand hygiene and providing privacy. Can you tell me your name and date of birth?
Anna Hardiman, June 17, 2004.
Do you have any allergies?
Nope.
Checking your wristband, checking with provider's orders. It looks like today we're going to be doing a head-to-toe assessment. Is that okay?
Yep.
Do you have any concerns before we start?
No.
Do you need any assistance walking, using the bathroom?
No.
Do you wear glasses or hearing aids?
No.
Do you have any problem speaking?
No.
Behavior is appropriate. Mood is polite and cheerful. Speech is clear. And posture is erect. When was your last physical?
1 month ago.
Do you take any medications?
Nope.
And when was your last surgery? Or do you have any?
I haven't had any surgeries.
Okay. Alright. So I'm just going to start with getting your height and weight. Over here to the scale. Alright, 117 on the dot. And now I'm going to, oh, sorry. You can step back now. Okay, and now I am getting your height. You can step back down. Okay, 65.5 inches, which is normal. Her height and weight is ideal. Patient appears to be appropriate, or patient appears to be, looks the right age and gender that she states she is. I'm going to get your temperature underneath the tongue. .3, which is normal. I'm going to get your pulse, maybe. I got 70 beats per minute and 16 for respirations. Okay. Oh. I am now going to get your blood pressure, and my equipment has been cleaned. Blood pressure cuff is the appropriate size. First, I'm going to get a baseline just by feeling for when her pulse disappears. Okay, and it disappeared at 120, so that's going to be my baseline. I would wait 1 minute till I got her blood pressure. 1 minute has passed. Sorry, did I hit you with my hair?
No.
Okay. .116 over 78, which is within normal limits. Stage 1 hypertension is, Stage 1 hypertension is 130 to 139 over 80 to 89, and elevated is 120 to 129 over 80. Okay, moving on to the head. Her head shape is normal, it is symmetric. I am observing for any signs of any tenderness, lumps, or bumps. Inspecting the hair, no visible infestations. I'm going to palpate the head for tenderness, no signs of tenderness. Hair is soft and not breakable and distributed evenly throughout. I'm going to test cranial nerve number 5. I'm going to have you raise your eyebrows, puff your cheeks, frown, and smile. All movements were symmetrical. I'm now going to test cranial nerve number 7. Close your eyes and tell me when you can feel it.
Feel it. Feel it. Feel it. Feel it.
Perfect. Cranial nerve number 7 is intact. Moving on to the skin. I'm inspecting the skin, looking for any lesions, bruises, and the color. The color is uniform throughout. I'm going to palpate the skin. Her skin is warm and smooth, not abnormally dry. I palpate for edema. She has no edema, but the edema scale is +1 for minimal depression and rapid return, +2 for 4 millimeters of depression that returns within 10 to 15 seconds, +3 is 6 millimeters depression with +3 is 6 millimeters of depression that returns within 1 to 2 minutes, and +4 return is 8 millimeters depression that returns within 2 to 3 minutes, and that is grossly epidemis. I'm going to inspect her nails. They are normal color and shape. Same thing with her toenails. I'm going to palpate. Capillary refill is instant. Capillary refill on her toes is instant, and her nail texture is smooth, which is normal. And I'm going to move on to the neck. I am inspecting. Her neck is symmetrical, no signs of any lesions or lumps. I'm going to palpate the trachea, which feels normal, no signs of tenderness or bumps. Same thing with the thyroid, which feels good. I'm going to feel her carotid, one at a time. Good. I'm going to use the bell side of my stethoscope to auscultate. Good. No signs of any bruits. I am going to palpate her lymph nodes. I'm feeling for any tenderness. I have the supraocular, subaocular, subavicular, supravicular, occipital, submandible, tonsillar, mental, and then superior cervical, anterior cervical, posterior cervical, and turn your head, and then deep cervical, other side, anterior cervical, posterior cervical, and if you turn your head, deep cervical and subclavicular. And then I'm going to have you lay down. I'm going to have you turn your head to the side, and I'm going to raise the head of the bed looking for JDV, which is a large pulsation in the neck, and no signs of JDV, which is good. I am going to do her cardiac assessment. So looking at the chest, I'm looking at the pericardium, looking for any abnormalities such as lesions, lumps, or pulsations. I am going to palpate the pericardium, feeling for any tenderness, lumps, or thrills. And I don't feel any of that. I'm going to auscultate with the diaphragm side of my stethoscope, starting at the aortic, pulmonic, which is where S2 is best heard, and then herbs, tricuspid, and then mitral. Tricuspid and mitral is where S1 is best heard. I'm gonna go under her. I'm gonna go under her shirt to listen for her apical pulse. And then, oh my God, I'm gonna do that for 1 minute. I got 70 beats per minute, which is normal. And I'm going to now palpate her peripheral pulses, starting at the temporal, and then brachial, radial, femoral, popliteal, and then tibialis, posterior tibialis, and then dorsopedius. Her pulses were the same in rate and rhythm on both sides, which is good. And I'm going to move on to the abdominal assessment. I'm just going to place a pillow underneath her knees. Do you have to go to the bathroom?
No.
I'm going to first inspect her stomach, looking for any abnormal lumps or anything like that, and it looks good. I'm going to use the bell side of my stethoscope to listen for bowel sounds. Yeah. She has hyperactive bowel sounds, which is normal. She's just hungry. And I'm going to listen to her, the arteries, so the aortic, renal, iliac, and femoral, which are the same in, same on both sides, which is normal. I'm going to palpate, feeling for any tenderness or lumps, and then percuss, which is normal. Okay, and it looks like that is all I did. Okay, I can have you sit up again. I can use this. Okay, I'm going to go on to the eyes. I'm inspecting the eyelids. No signs of edema, lesion, abnormal drainage, or abnormal color. Her eyes are the same alignment. They are symmetrical. Her pupils are normal size. They are both the same size. Her iris is blue. No abnormal color or size there. Her sclera is white. No signs of lesions. It is moist. Can I have you pull down? Her conjunctiva is pink and moist, which is normal, just how you want it to be. Her eyelashes are uniform throughout, and no redness or swelling or anything like that in her eyes. I am going to inspect her peripheral vision, so tell me when you can see my fingers.
I can see him. I can see him. I can see him. I can see him.
Good. I'm going to test cranial nerves 3, 4, and 6, which is using the cardinal gazes. Just follow my pen light. Perfect. Her eyes move symmetrically, no shaking or abnormal movements. I'm going to shine the light in her eye, looking for pupil accommodation. This is direct. I'm looking at the direct and consensual. So the direct is the eye I'm shining the light into. Good. And then the consensual, her other eye that I didn't shine the light into, also moved with the eye that I shined the light into, which is normal. And let's see. I am going to have you hold this arm's length about in front of you. I'm testing cranial nerve number 2. Read the bottom line that you can read.
LTFPH.
Good. 20/20 vision. Okay, moving on to the ears. I'm inspecting the ears. No abnormal drainage or color or any lumps. No foreign bodies in her ears. I am going to palpate, starting with the pinna, folding it down, pressing on the tragus and the mastoid process. No tenderness. Same thing on her other ear, the pinna, the tragus, and the mastoid process. No tenderness there. I am going to use the otoscope to look in her ear. For an adult, I'm going to pull up. For a child, I'm going to pull down. Since she's an adult, I'm going to pull up at her pinna. Her tympanic membrane is pearly gray. She has a small amount of crumen, which is normal, and is yellow. No bleeding or signs of irritation. Now the other side. Same thing there. Her tympanic membrane is pearly gray. She has a small amount of crumen, which is just yellow. No signs of bleeding, foreign bodies, or irritation there, which is good. I am going to test cranial nerve number 8 by going behind her and repeat what I say. 3W8.
8P.
Perfect. Client is able to hear just fine in both ears, which is good. And I'm going to move on to the mouth. I'm going to inspect her lips. Her lips are normal in color, pink, no lesions or cracks. I'm going to shine my light in your mouth. No bleeding or edema of the gums. Her teeth are white, well cleaned. She has 28. I'm looking at the mucosal membranes. They are pink and moist. Her buccal membranes are pink and moist. Her tonsils are not inflamed or have any exudate. Can you lift your tongue up? Her sublingual membranes are moist and pink, and stick your tongue out. Her tongue is pink and no abnormalities there. And her soft palate had no lesions or abnormal colors. For palpating her tongue, I would have gloves on, and I would use my 2 fingers to apply some pressure on it, just feeling for any lumps. And to test the cranial nerve number 9, I would place a tongue depressor in the back of her mouth, but I'm not going to do that because I don't want to gag her. And I'm going for cranial nerve 10, I'm going to have you open your mouth and say ah.
Ah.
Uvula moved with voice, which is good. Uvula is intact and midline. Can you say light, tight, and dynamite?
Light, tight, dynamite.
Perfect. That is cranial nerve number 12. Okay, I'm going to put gloves on to palpate her lips. Good. No signs of no tenderness or lumps or lesions, which is good. I'm just going to do the skin, the neck, the ears, the eyes, the head. Okay, moving on to respiratory, I am looking at her breathing, watching her chest rise and fall. She's having no difficulty breathing. She has a normal rate, rhythm, and depth, and no struggles breathing. I am going to listen to the anterior, lateral, and posterior sides of her lungs with the diaphragm side of my stethoscope. I'm going to do 10 on the front. Good. Breaths were lateral throughout, the other sides. Okay. Just gonna move your hair. Good. I listened to 10 spots in the front, 4 on each side, and 18 in the back. I am going to check for tactile crepitus. So when I move my hands, just say 99.
99, 99, 99.
And her coastal angle is 90 degrees. I'm going to do the same thing on the back.
99, 99, 99.
Take a deep breath. Both sides of her lungs moved at the same time for the same depth for her breath. And going on to neural, I'm going to have you check your finger with your nose. I'm going to have you touch my finger to your nose. Okay, and I'm going to test the Babinski reflex. Starting at the bottom and going forward. Good. Okay, she was negative at the Babinski reflex, which is just what we want to see. Adults should not have any curling of the toes for that, only babies, which is what she just did. Okay, so I'm gonna have you remember 3 words: blue, car, grapefruit. Can you count back from 10?
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
And do you know why you're here today?
For a doctor's appointment.
Do you know how you got here?
I drove.
Level of consciousness, patient is alert and orientated ×4. And do you remember those 3 words?
Blue, car, grapefruit.
Perfect. And that's it for neuro. For the musculoskeletal, I'm going to observe and feel your range of motion, starting with your jaw, open, close, forward, back, good, open, close, forward, back, and your neck, go to the side, and then look side to side. And then cranial nerve number 11, you want to raise your shoulders and move symmetrically, and her neck and her jaw, or the it moved symmetrically, no problems, no signs of crepitus. I'm going to have you with your arms go out and in and forward and back. Good, out, in, forward, back, and your knees, legs. Good. I'm going to watch you do it. And then your ankles, dorsiflexion and plantar flexion. You're going to feel no crepitus. Now your elbows, flexion, extension, supination, pronation. Good. Do it again. Good. And your wrists, flexion, extension, rotation. And your fingers, extension, flexion, adduction, abduction. No, adduction, adduction. Perfect. And I'm going to have you stand up and with your hips, one leg forward to the side. Good. Forward, side. I'm going to feel your hips now. No signs of crepitus. And then I'm going to palpate your spine while you lean forward. Good. No signs of kyphosis, which is a curvature in the thoracic spine, lordosis, which is a curvature in the lumbar spine, and scoliosis, which is a curvature in, which is a lateral curvature in the spine. And I'm going to have you walk 10 to 20 feet, which to that table and back. Yep. Gait is steady and symmetrical movements throughout. Her pace was also steady. You can sit down. I'm going to test your muscle strength, so I'm going to have you push against my thing. Good. And now your arms, hold them up like this. Push, pull, good. Fingers, good. And push, okay, pull, push, and pull. Oh, not really, but muscle strength was symmetrical throughout. Size and strength was the same on each side, and range of motion. She had full range of motion in all extremities, and looks like that's all I have. Do you need anything while I'm here? I have time.
Nope.
I'm going to lower the bed, make sure it's locked, no signs of falls, collar light in place, bedside table within place, and I will document my findings.